Hi there, I'm Jamie Taylor. Welcome to Your Health Matters, brought to you by Kingman Regional Medical Center, your not-for-profit, community-owned hospital. This program is based on bringing you information about healthcare issues that are relevant to you. We've got healthcare professionals and physicians that are here to answer questions you might have. We also have a program called Mayo's Medical Edge that has information about those issues and helps show the relevance of Mayo Clinic right here in Kingman. My guest today is Dr. Paul Yamaguchi, who is our pain management specialist here at KRMC. So stay tuned, we have lots of information for you about dealing with pain. Welcome back to Your Health Matters. My guest today is Dr. Paul Yamaguchi, a pain management specialist here at KRMC. Thanks for being on the show today.
You're welcome. It's my pleasure.
Well, it's exciting to have you. We're here to talk about pain, but I'm curious how, because I believe you said you started in anesthesiology, so how do we go from anesthesiology to pain?
It's actually a regular transition, and anesthesiology has actually been at the forefront of development of the specialty of pain management.
Okay.
We, of course, are involved in managing patient's pain during an operative procedure, so therefore we immediately just have evolved into the area of pain management.
I suppose, and there's a lot of different types of anesthesiology, right? Because I mean, I think sometimes you think of anesthesiology, you know, put it on your face or give you a shot and you go to sleep. But there's other types as well.
That's correct. There's regional anesthesia, spinal, epidural, local blocks, and there's a variety of ways that people can endure a painful operation without having to experience pain.
That's a good thing.
Exactly.
I've had a number of surgeries in my life and I'd rather not be awake, thank you.
Yeah, exactly.
Well, so tell me, where did you go to school to learn?
I went to medical school at the University of Colorado.
Oh, okay.
And following that, I went to a small hospital back east by the name of Johns Hopkins.
Oh yeah, small hospital.
And that's where I did my anesthesia and pain management training.
Okay, very good. Yeah, Johns Hopkins I think is pretty well known, even here in Kingman. You know where that's from. And then how long have you been here in Kingman?
I came back to Kingman, actually I've been in Mojave County since 1992.
Oh.
I practiced in Lake Havasu, and then I started moving around, came up to Kingman for a short while, but I've been back in Kingman now since 2007.
Oh, okay. You came to the cooler part of the state,
right?
right?
Oh, I love Kingman, and it is quite a bit cooler than Lake Havasu.
Especially this time of year. Oh my goodness, I know. I don't know how people deal with that heat down there.
That's right.
So in 2007 you came, and now your wife is with you here as well?
Yes.
Right, very good. And what kind of things do you like to do outside of work when you're not managing pain?
I enjoy hiking. I have 2 dogs.
Oh,
and
do they hike with you?
Yes.
Oh, good.
Yes.
Very good. Yeah, mine, I have the same thing. Yeah, we live up in the Peacocks, and they like to take off and go hiking with us all the time. And I think you live like in the Lazy YU area, right?
Yes,
So you're up in the Wallapies. Very good. So when someone comes to you with chronic pain, right, and that's the type of thing when we say pain management, I mean, you're not just dealing during surgery, you also have patients who are in pain for back, things like that, right?
Correct.
Okay, and so that's when you do with those other types of anesthesia, the blockade or local blocks and stuff?
Yes. We tailor our treatment to the specific problem that a patient presents with. So frequently a patient comes to us and we have to essentially establish a diagnosis before we move forward on any specific treatment path.
Okay. Well, we're going to watch a little video here from Mayo Clinic. They have a program called Medical Edge, and it has different health topics. This one's on migraines and vertigo, which I know we've talked about is a little different than what you deal with, but it is pain, and we'll kind of go from there after we watch it. Let's watch it together quick.
That sounds great.
Vertigo. It feels like the room is spinning around you. Many bouts of vertigo are caused by crystals in your inner ear that come loose. But for some vertigo sufferers, the dizziness happens thanks to migraine, the same condition that can cause severe headaches. At first, Lori Taylor thought her intense dizzy spells were caused by high blood pressure, but then another symptom hit.
I would get these vertigo spells, which would turn into this massive headache.
There's no way she could work in the garden during one of those episodes.
The only thing that really helped it would be to sleep.
It's been recognized for over a century that there's probably a link between migraine and vertigo.
Dr. Scott Eggers says people like Lori who have migraines are 3 times more likely to suffer from vertigo than those without migraines.
The things that make us suspect that a patient might have migraine-related vertigo would be recurrent episodes of vertigo that are associated with some other migraine features.
Like sensitivity to light, sounds, or smells. You see, migrainous vertigo is not the same as benign positional vertigo, which is caused by crystals in your inner ear breaking loose. Instead, it may be related to the migraine's neurochemical and blood flow changes in your cerebral cortex or brainstem. These changes may disrupt signals that relay information from the vestibular or sensory system in your inner ear, causing dizziness, nausea, and other symptoms. And some people with migrainous vertigo don't always get headaches with their attacks. Lori says once Dr. Eggers figured out the cause of her vertigo, she got medication, beta blockers, to treat it.
And thanks to the medication, Lori almost never has headaches, and very rarely will she have a bout of vertigo, but it's mild, and she's regained a lot of balance in her life.
It's like, oh, freedom.
Migrainous vertigo can be tricky to diagnose. That's because doctors sometimes need to rule out other causes as they narrow the diagnosis. For Medical Edge, I'm Vivian Williams.
So migraines, I know you said that there's different kinds of pain, and sometimes you have to refer to other physicians if it's outside of what you're dealing with.
Yeah.
So you usually focus mostly on lower back, is that right? Or
Headaches are part of what
okay.
we involve ourselves with as well, but migraines specifically usually are under the purview of a neurologist,
Okay.
and they usually have more expertise in treating the variants of migraine than what I've been.
Okay. Well, and that's one of the things we've talked about on other programs, how, and even like with Mayo Clinic, their kind of base, if you would, is collaboration and knowing your strengths and weaknesses, and knowing, you know,
Right.
we don't all know all the answers, and it's good to have a team that we can work with together. So one doctor might specialize in one area that another doctor doesn't, but you support each other. So that's a good thing.
Yeah, exactly.
To be able to do that. And we're blessed to have such a wide range of physicians. I mean, I know we still have a few gaps here in Kingman that we don't have, and we're always recruiting and trying to bring more here. But we do have some really awesome, like yourself, physicians that we're blessed to have chosen Kingman. I think that's pretty cool.
Oh, we have a great staff of physicians here at Kingman.
Yeah.
I
So
really can appreciate that.
when someone comes to you and as an outpatient with pain, lower back pain or something like that, and you've made that initial diagnosis, what kind of options are there for helping them with their pain?
We look at exactly what is causing their pain and how much that is affecting their life, and sometimes the most logical option is actually surgery. So a person presenting with low back pain with significant neurologic problems may actually bypass anything that we would do in pain management and go directly to a neurosurgical procedure. But for the most part, patients fall short of being that aggressive, and so we offer medical management, which is prescribing medications, trying to utilize physical therapy, chiropractic care, alternative medicine approaches, and trying to ameliorate a person's pain by things that are more conservative than surgery.
Sure.
And then if those things don't work, then there are injection therapies that might be tried. And also we have other more aggressive procedures that we use in pain management, such as nerve stimulators and pump therapies that are implanted that
Okay.
can be utilized as well.
So surgery is like the last resort, obviously. We try these
Yes.
other things first.
Yes,
And I know
exactly.
that now, like the pump, is that one of those where it injects the medication
Exactly.
on a kind of as-needed
Yes,
basis?
yes.
Okay, and then the nerve block, is that what you said earlier?
There's a nerve stimulator,
Stimulator,
that can
okay.
actually be inserted in along the spinal cord and basically distracts and scrambles some of the messages that are coming from the extremities, for instance, and traveling up the spinal cord,
Oh.
registering as pain.
So you just tell it, no, that's not pain. No, I don't
To
know.
a certain extent, yes. It's a scrambling message, and it's an electrical input,
Okay.
and we try and give it
Yeah. But I
directions that sometimes it obeys, and other times it completely
Ignores it.
our efforts.
Well, I don't mean to make light, because I do know that pain can be so debilitating. You know, I've known people who have just had that chronic pain, and it makes it difficult just to get out of bed in the morning,
Yes, yes.
and let alone trying to have a day-to-day job type of thing. Now, if someone is dealing with chronic pain, they go to see their primary care physician first, or can they come right to you?
We require that the person have a primary care physician or provider in order to coordinate and monitor all the various efforts that may be enlisted to try and take care of a patient.
Okay.
So a patient may be referred to physical therapy, a chiropractor, to a surgeon, to an orthopedic surgeon, to a neurologist. There's a whole variety of other practitioners that will
Depends on what the pain
be
is, the root
involved.
of the pain is, what's causing it to begin with.
Right, and that's
Okay.
why a primary care provider is essentially the captain of the ship that helps make sure that somebody isn't independently doing something that potentially could interact with something that another provider is utilizing on the same patient and have a conflicting.
Well, yeah, that's important,
Problem.
'cause, I mean, even with medications, I know you can run into that
Exactly.
if you've got too many doctors prescribing and not knowing what the other one is prescribing, and they can have a negative interaction with each
Exactly.
other, not help each other.
We don't want to get into the situation where too
Right.
many cooks are spoiling the soup.
Right, right. Now, what about patches? It seems to me I've heard something about patches for pain too. Is that got like a medication in the patch?
Yes, in fact, there are over-the-counter patches that are available now. But
Really?
the patch delivery system for
Mm-hmm.
medications is not a cutting edge, but it's recently more explored area where various medications can be delivered through the skin, and rather than having to swallow a handful of pills every day,
Or get
application,
injections? and
right,
things like
application
that?
of a single patch
Okay.
can provide some pretty good
Well,
results.
that's interesting. I'm learning new things every day, every time I have this show. We'll be back after these messages. I want to talk a little bit more about that and maybe some other alternatives for people in pain.
Sounds
So
good.
stick around. We've got more to come in the next half of the show.